So let's discuss about the femoral triangle. What is a femoral triangle? It is a hollow, wedge-shaped space in the upper front part of our thigh. That is a triangular-shaped space in the upper front part of the thigh. That is where the femur is located. That is the biggest bone in our body, and it is the pathway for the major blood vessels and nerves. So it is a triangular-shaped space in the upper front part of the thigh, forming the pathway for the major blood vessels and nerves. Now coming to the boundaries, it is a triangular shaped space. So the top or the superior border is formed by the inguinal ligament, the outer or the lateral border by the sartorius muscle, and the inner or the medial border is formed by the adductor longus muscle. So three muscles, inguinal ligament, sartorius, and the adductor longus muscle. This can be remembered by the mnemonic SAIL. S for sartorius, A for adductor longus, IL for inguinal ligament. That is SAIL, SAIL. And now the floor is formed by three muscles, iliopsoas, pectinis, and adductor longus, and the roof is formed by the fascia lata. Coming to the contents, from lateral to medial, femoral nerve, femoral artery, and the femoral vein, which is drained by the great saphenous vein. Artery, nerve, and vein, everything is enclosed within the femoral sheath. And this can be remembered by the mnemonic navel. That is nerve, artery, vein, empty space, and the lymphatics. So what are the contents? Femoral nerve, artery, vein. And coming to the clinical anatomy, the femoral pulse can be palpated inferior to the femoral artery, and the mid-inguinal point, that is the femoral artery, crosses midway between the pubic symphysis and the anterior superior iliac spine. And since this femoral artery is superficial, angiogram can be done. And femoral triangle is also known as the Scarpa's triangle. Thank you. This is all for today. Thank you.